say it ain't so. So let me pull up this information. Wait for you guys to come back in if you didn't have to go to work or cook, put the kids to bed like I should be doing. But you see how I really don't have time. This one. No, you guys have been waiting. But when I really say I don't, I apologize, but I be so busy. Like, I really have to get Aiden ready for bed. So I'm going to show you guys what I purchased. How much was this? $239 or something. Okay. So I'm not going to wait around. Maybe I should. Okay. I'll wait until, okay, y'all coming back. I'll wait until 3 minutes. And then I'll get started. Cause I got some things I need to do. And I have to put Aiden in bed, and I have to study tomorrow. Study tonight also. So 1 more minute and I'll go ahead and get started. In the meantime, my lips was dry and my mouth is dry. And it's delicious. It's Stella Rose. It's delicious. Sweet wine. Okay. 30 more seconds. More difficult. The F&P program. No, I don't think the F&P program was more difficult because, like I said, it's the same workload. So I don't think it was more difficult at all. As I said with both programs, I believe, but this is me, that both programs were easy. The only thing with family or Jerry, it's like, or neonate or whatever it's called, you have to focus on the whole body. It's so many systems: the heart, the lungs, the liver, the kidneys, and so many diseases also. It's so many medications. It's just so much. So, like I said, if I would have known that psychiatric mental health, it entails what it entails as far as a provider, I would not have went for family nurse practitioner. I would have just went for psychiatric mental health. And once I worked at Pontiac General in the psych unit, and I seen what that was all about, I would never have worked at nobody. I never worked in the hospital and never will work in the hospital. I am all about, I'm not a lazy worker, or don't get me wrong. I try to be very knowledgeable in whatever I'm doing, but I work the job. I do not let jobs work me. And I give people that advice all the time. Make your job work for you. Do not let your job work you. And that's why I tell Cenas that pick up extra shifts and just work so hard, and they're so devoted and so loyal, and most of these companies don't care. Like, elevate yourself. You could be making more money and you can be doing things. You just have a lot more opportunities or whatever. Always continue to elevate yourself. And you want to get in a position where your work is fun. You don't feel like you working. You know what I mean? You enjoy what you're doing. So with that being said, if I would have known that psych nurses, LPNs, RNs, exactly, if I would have known that okay, first of all, the patients come to you. You don't have to walk all around a nursing home passing out medications and stuff. And no, they come on. The techs there, they're like, if you want to say seen us, but they're not seen us, because you don't have to do no patient care in psych. Okay, you're not even going to psych if you need patient care. You're not coming. No, we don't have nobody here to give you a shower, change your diapers. If you have wounds, you're not coming to psych. You need medical care. You have to be in good, like when you're buying a used car. You want it in good condition. It don't have to be perfect, but I'm not banning you unless you're in good condition. Same thing with psychiatric patients. They are not accepting them if they have a lot going on, if they're violent and acting crazy or whatever, aggressive. No, just stay on there, honey. Stay in the hospital, and when he calm down, ma'am, call us on back, and we'll let you know if we can sec them at that time. So, psychiatric, LPN, RN, techs, it's the best job ever. Best job ever. The only thing you have to worry about is you have to understand, and it's hard, but you have to always think like, I don't know about when I'm starting the DMP. I did talk about the DMP in the last video as far as my graduation, when I posted a graduation video. So check that one out, and I talk about the DMP program. This one, I'm going to talk about the resources that I'm using to prepare for the certification exam. I was thinking, if I do, but I talk about that already. So I try to keep the videos under 30 minutes. So, but y'all know I'm a little long-winded, but because I always think of stuff, nothing is rehearsed. So, the psychiatric mental health is where it's at. And if you don't have experience, they still hire you. But if you do have experience, you can get contracts, and they pay like $50, $65 an hour. Some people I found out, they didn't even have experience, but they put it on their resume, and I wasn't that smart or deceiving. So, I had to get the little 35, 38 an hour. So, but mental health is where it is at. Okay? So anyway, I would have did, like I said, I wouldn't have did the family nurse practitioner program had I known. I just would have did the family nurse practitioner program, and then I would have did the DMP. So I did the family nurse practitioner program, psychiatric mental health program. I'm TAD. So that's why I'm like, iffy about when I'm going to do this DMP, etc. So that's that. Now, but it's the same as far as workload. I don't think the F&P program was harder. No. As far as studying, I enjoyed studying psych. I think I enjoyed studying F&P too, but psych, it just do something to my soul. It does something to my soul. I love it. So anyway, I think this is $295, I believe. So, ANA. Okay, you can just go to their website. Actually, I'll go to the website and I'll show you guys, because y'all know how I do. I try to show y'all everything. So, I will type in psychiatric mental health nurse practitioner review course. Okay, and when you type that in, it's a lot of things that come up, because everybody's trying to make some money off of this. Okay, American Nurse. Where is it? Right there. right here. Right there. So click on it. Unplug it. Click on it. Let's see what we get. If you are a member with the ANA, it is $269. I'm a member, so I paid $269. If you are not a member, what is it? $359. So it don't have any audio reviews. You know, I like audio reviews, so it was kind of sucky that they didn't have audio reviews, because I actually did think that it was some audio reviews, because I like to listen to things while I'm driving, while I'm cleaning up, while I'm showering, or whatever. When you complete this, you get 30 contact hours. And so let's go back to what it looks like. So it's called D2L. And this is exactly how Purdue classes are. This is exactly how it looks. Just like this. Have your content and everything on the side. You know, your topics and a check mark you get once you completed it. It looks just like the Purdue website, but I guess it's D2L Learning. Okay? With Purdue, your name and everything. It looks just like this, okay? So this is how I'm studying. So first, what I would do is go to the learning activities. So this is module 1. This is module 1, right? So module 1. Here we go. And you guys see the topics, right? All the topics it hit. Okay. Module 2. All the topics it hit. Then you go to module 3. I think it's 3. I can't see. Some. Oh shit. I mean shoot. Damn it. Sorry. It's course materials. Turn it. Went all the way back there. Okay. So now go back to learning activities and the modules. So 1, 2, 3, 4 modules. So I was on 3. Here's the topics. Okay. Not the fudge cake, son of a biscuit. You know what? I don't know. Okay, let me know. Let me see. I'm just all over the place. Anyway, y'all seen 3. Oh, it is a tablet, right? Here we go. Now, okay, so 3. Okay, so then you go to four. Okay. Then after 4 is check your knowledge. You have to do assessment. I think it's 5 questions. Okay. And then you move on to 5, module 5. Okay. After 5. It is 6. It hit all topics, okay? All topics that you will be tested on. Okay, 6. And then after 6, another check your knowledge. Self-check 2. And then a quiz. And I think the quiz is 10 questions. 5 and 10. Okay? So that's that. So then after that, you get your completion. Okay? Verification of completion. Okay? Then course evaluation. You have to do a course give your, evaluate the course. And then they give you your certificate. 30 contact hours. Okay? So with this being said, this is how I set up study time. So okay, learning activities. So for example, module 1. So I say, okay, what do I need to study in this module 1? Okay, these are the things I need to study. So then I get my calendar. My calendar is messy because I was not on point with the days of studying. Remember, just because you set some dates for studying don't mean you have to abide and you have to get it done. So you can't go to sleep until you get this done. You just have to change your days. Oh, I paid for the certification exam, ANCC. That's the only one. You don't test with AAMP. They are trying to create a test for in the future. You can choose them. But right now, you only test with ANCC, which is BC. And at the end, you see F and P BC, then their boys certified through ANCC. If you see FNP or psychiatric mental health or whatever, if you at the end of the credentials, if you see C, then they went passed the exam through AAMP. Okay, so I get my calendar and I just say what I'm gonna study each day. Okay, and I write it in there. And so I think I went 2 days without studying, so I had to move some stuff around. So I was supposed to be done studying. Oh, so I applied for it. I got, you have to, in course M's, it's going to be a form that you have to download, fill out your portion, and then email it to the dean, and it'll have the email and instructions all on it. You get it from course M's. You have to send that to them so they can finish completing it, and then they send it directly to ANCC. You are responsible for sending your transcripts to ANCC. And so I think they use Perchman or something. They have a link where you can just say you want to, like I use ANCC email address as this, like the recipient or whatever. And you just send that. It's easy. And you just send it to ANCC. Once they received all that, then you get a authorization to test. If you don't pay, I think it's $70 for expedited, then you have to wait, like I think they said 3 weeks, and sometimes it can be longer. So I'm waiting for a date. So while I'm waiting for a date, I'm studying, okay? So if I would have stayed on track, I would have got done studying. I would have got done with this on the 26th. But I had to redo my calendar. And so now And then I had to, some days I was putting down I was going to study 2 topics or whatever. Then I seen the topics is too darn long. I can't do 2 in one day. So I had to change it and put 1 per day. So once I did that, if I stay on track, I would be done May 11th studying. And then I would do test banks for a week, and I would schedule my exam for the 16th of May. Okay, so that's that. So this is how I do it. Go here, say, or my calendar, because it's wrote in my calendar. So I'll go to my calendar, like, okay, what do I have to study today? And so I have to study pathophysiology, okay? So I go to this guy. Like I said, I swear by him, okay? So he gives mnemonics and everything, and he like he have YouTube videos too. So I found him on YouTube. I was listening to his YouTube videos and I loved them, and then I found out he had books, so I ordered these from Amazon. So psychiatric, this is all the psychiatric disorders, okay? All the medications, okay? I'm gonna leave it up here a little bit just in case y'all wanna write it down or screenshot it. Okay. Okay. Amazon. I swear by him. Jonathan. It's my homeboy. Okay. So I go and I'm like, okay, what are we talking about? What are we studying? Patho. Okay. So I go. I look at the topics. Okay, so let's talk about the first one is neurological basis of development theories and disease state. Okay, so this one is talking about all the psychiatric disorders: schizophrenia, major depression, bipolar, panic. So I know I'm going to start with this book. Okay, so okay, we talking about schizo, right? So go in here. Where is schizo? And I think it was like something else, under something else. It wasn't schizo. What was it? Psychopathy, maybe? Yeah, so page 371. 371. This man is awesome. That's all I can tell you. If y'all don't get these books, I mean, I don't know what to tell you. 371. Okay. So, let me see if they out. Anyways, I don't understand why I can't. I don't remember exactly what chapter it was. I already studied this, but I don't understand why I just don't have schizo. You know. Oh, I went to the back and found it. I'm sorry, guys. You can always go to the index, okay? So, dementia, psycho, sleep, addiction, anxiety, personality disorders. Chapter 12. It might be on 12. It might be 12. Oh, 25 minutes! That's what happens when you don't prepare and study and all that, when you freestyling. Psychiatric emergencies, that's suicide. Okay, so it must be chapter 12. And chapter 12 is just, oh, personality, 211. Okay? 211. Personality. Personality. This is so irritating. I'm sorry, guys. Okay, here it is. Oh no, that's schizotypo. Schizotypo is different than schizophrenia. Okay, this is irritating. So I can't. My patience is, no. Let's go to major depression, okay? Let's go there. Page 55. I just want to show y'all what he does and how awesome he is and how you really learn. Okay, sorry. Depression, okay? So these bold points or whatever, bold letter words or whatever. So what he does is give you mnemonics. For example, here's the mnemonics for depression. Siggy Cap, y'all heard of that, right? So I go through this book and it really, he gives you in detail, explain it. It's all of this. I'm not trying to get y'all to show the words. I'm just saying how much detail he going in about depression. And then you see the bold printed words or whatever. And then mnemonics. He give you mnemonics. I would suggest writing the mnemonics as you're going through each chapter learning. I would suggest writing the mnemonics down on a flashcard. Okay, I didn't start it, but it was like a light bulb. Like, why aren't you writing these mnemonics? You know, so when you don't have time to read and you doing something, whatever, you can just pull out your cards and make sure you know the mnemonics. Okay, so he breaks it down and he gives you mnemonics. Okay, so after I read this and I got a clear understanding of the disorder, then I go to the review book. So I go to depression. Now let me show y'all how this book is just a review book and they expect you to already know this stuff. So they really don't go in depth on these topics. They just give you a brief synapse. So 139. 139, 133, 139, chapter 9. Okay, so now we at depression. And it's just going to be a review. Bullet points. Just a quick review in this book. This book is good for if you don't have any other study material, because some people say they just studied from this and passed. I think this book is good if you are a note card, flashcard learner. You can use this book and write a lot of flashcards and go through 600 flashcards and study like that if you want to. So it's just brief. You should already know. Let's just go over that. So that's what I do. So I do this, get a full read this one. Yes?
I'm not really good.
What you feel like?
Sick.
What tell me what's going on.
It hurts.
What hurts?
I got my tummy ache.
Do you have to boo-boo?
No, because I'm sick.
Do you have to throw up?
No, what?
Maybe you should go no. Maybe you should go boo-boo.
No.
Maybe you should pause the iPad and go boo-boo.
I can't.
Okay, so I go through this, get a clear understanding of this disorder. I have no idea where your credit card. Oh, you put them in there on the couch in the armrest. Get a clear understanding. Then I do the review. Then after I do the review, I'll come to my course and I'll click on major depression. So when I click on major depression, this is also like a review, okay? So I click on it, and then it says, click on each one of these to learn more about it.
Major depressive disorder, MDD, is attributed to approximately 1/3 genetic and 2/3 environment. Mutations in SERT in chromosome 17q11.1-q12, family history, 30 to 40%, 3 times risk with first-degree relatives. The pathophysiology of MDD remains largely unknown, but several mechanisms have been proposed. Example, the monoamine hypothesis. MDD is a prevalent disorder with a global point prevalence of approximately 5%. The lifetime prevalence rates of MDD in the US and Western European countries are. Treatment consists of antidepressants. The mainstay of treatment is usually medication, talk therapy, or a combination of the two. Increasingly, research suggests that treatments may normalize brain changes associated with depression. More research is needed to identify candidate depression susceptibility genes, environmental triggers for the illness, and how to predict treatment response. A variation
So,
in the ABCD
for each
gene coding
topic that I went through for each module, it has the same thing. You click on it and learn more about it, okay? And then they have the knowledge check to make sure, like for instance, like they talk about the bipolar, and you click on the same thing, okay? And then it say knowledge check after you go through depression and bipolar. Now it say knowledge check, and it has a question. You know, let me see if I know the answer. Among first-degree family members of individuals with bipolar disorder, BPD, the risk for bipolar disorder is between 2 to 3 times that found in the general population, 15 to 20 times found in the general population, or 7 to 10 times found in the general population. And I believe it was 7 to 10 times found in the general population. Let's see. And then you click on your answer and you push submit. Correct. And then it gives you like a rationale on the side. Okay, your girl is learning something, okay? So that's that. So that's how I go through it. So, you know, if the topic is about, I haven't got that far where it's about drugs, but I've looked in these books or whatever, and it's mnemonics, and it's really easy. So these are the books that I'm really using right now. And then I have the so that one, Jonathan, that one, and that one. And then I also have some other gems. Now this is what you need for clinical, okay? You should order this from Amazon, and you should take this to clinical with you, okay? So inside here, guys, it's a little gem. You know I give y'all the gems. Okay, so like topics, you know, this is the DSM-5. Now you cannot diagnose nobody with nothing unless it meets the criteria of the DSM-5. The DSM-5 give you all the symptoms, signs and symptoms that a person must have in order for them to be diagnosed. If they have to have 5 of the 20 things listed, they can't have 4 in a possible, and you diagnose them with depression or whatever it may be. If they say they have to have 5, they have to have 5 signs and symptoms. So for example, let's open it. Okay. So, oh, it give you the codes too. So let's see. Let's just say, let's just stick with depression, okay? No, 93. So let's stick with depression. Go to 93. Okay. Now, depression. It tell you everything here, what the person must have, signs and symptoms in order to be diagnosed with depression, okay? Let's see. And then you can diagnose them, and it gives you the code. Okay. This is the ICD. What is this? ICD codes for billing. Okay. You should. This is a must-have for clinical. If you're at clinical and you don't have a DSM-5 book, you put into way too much work into figuring out when your preceptor asks you a question. You put in way too much work, or you saying I don't know too many times. Okay. Get this book. So when he asks you a question about DSM-5, or some preceptors be busy and they see in the patient, they be like, look up the ICD code for blah, blah, blah. You got it. Or you can just go online or whatever, you know, or you can have these tagged, flagged, and, you know, go from there. So this is a good book to have. And then they have like, so coding and recording procedures. They tell you like, as far as mild depression, severe, moderate, blah, blah, blah. It breaks all that down in the DSM-5. Must have, okay? Then you have this. So I would suggest one topic, learning it, and then answering questions. So let's find depression. 39. Let me see how many questions. I haven't answered any of these questions yet, okay? Okay. I don't know how to say it like Cardi B. Okay, 39. Let me see how many questions they have for depression. Chapter 4. Depression. I have 31 questions. Right? Wait a minute. 4.12, yeah. 31 questions on depression. So you go and answer the questions. So this will be my test bank, actually. You know, I'm going to finish up Pocket Prep because I have like only 400 more questions to answer on that one. I think it's like 1,000. I'm going to go ahead and finish that, and I'll just do 100 a day once I get done studying. But I might, because really I'd rather do the DSM-5. Okay. And then I also got this book, and this is just case studies or whatnot. It just, the patient came in with blah, 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 blah. And then they ask you questions. What do you think the patient diagnosis is? What treatment would you give? Blah, blah, blah. That. Okay. So that's it, y'all. So if I can do it, you guys can do it. And most of you guys are doing it. So, let me see if I can look at comments. Thank you. Okay, Angie. All right. Now, you said, so are you finished up the, it is hot in here. Are you finishing up the psychiatric mental health program? Or what's going on with you? I don't see the chat. Oh, here it is. Okay. Top chats. I want all chat, not the top chats. Okay, so let me go back. Thank you. Ordering tonight. Looks just like our class. Okay, I will go back after we're done. Oh, it's hot. Are we going to Capella? Okay, so where are you in the program? Are you finished? Are you about done too? Sweating. Yes, I'm at Purdue. Graduation 10/23. Okay, congratulations. I'm gonna take a break. I'm not in a rush to do the DNP right now. And when I do start it, I think I'm not doing it. I I don't think I'm doing accelerated. I don't think I'm doing it fast. I think I'm going to focus on making some coins, and then when I feel like it, then I'll go ahead and get enrolled in the DMP program. And then I will just take my time. I'm not going to stress out with it, like to complete it. I'm not doing that. So that's that. So, anybody else got any questions before I go? Yeah, I'm tired. I'm tired too. Did you do Capella, Angie? Anybody else got any more questions before I end this? I wish I can see if somebody was typing. In Purdue, government, is that Governor's University? Govern University? October, so May, June, July, August, September, October, 6 months. So you have halfway through, more than halfway through, if this is your first master. 6 months left. Great. That's what's up. So if there's no more questions or comments, then I am going to go ahead and let you guys go. And it's going on 10 o'clock. Get Aiden in the bed and get ready for tomorrow. Go get my nails done. I'm going to a birthday dinner and a celebration after the dinner. So I got these dresses, 3 dresses I haven't even opened up. I have to try them on, see what I'm wearing tomorrow. Have to go get my nails done. I'm thinking about, do I want to go get a little purse or clutch or something. And then I have to go get my makeup done. And then head 30-40 minute drive. And that's the plan for tomorrow. And anyway, so that is that. I will talk to you guys again sooner. I'll let you guys know when I pass the exam. So I'll probably talk to you guys in thank you. I'll probably talk to you guys again in May, unless I have some time and something comes up. Then I'll get back on here. So thanks for your patience, and thanks for subscribing and tuning in. And for you guys that stuck around and watched the video, you're the winners, because I do care, because I want people to care and I want people to succeed, but I don't do this for the subscribers. I don't do this for the likes. I don't do this for however many people tuning in. Like right now it's 4, and it's been 4 for a while, and I don't care. Like, if you want to catch these gems, then you gonna be here, because I'm done. So you welcome. I'm done. So really, I'm just putting content out there to help you guys succeed, and whoever want it, they'll tune in, you know? So that's that. And you guys have a lovely night, and thanks for all the congratulations. And I will talk to you guys once I pass the exam. And like I said, I plan, pray for me, please. Pray for me that I'll be successful. And like I said, I plan to take it. I plan to schedule May 16th. So pray for me. You're welcome. So pray for me that I pass this exam May 16th. And I usually take it in the morning on an empty stomach, is what I was told when I had the F&P test anxiety in the past. And y'all know it, I didn't pass that until the 4th try. And that ain't me, because anytime I take an exam like the LPN, RN, I passed on the first try, only having to answer the minimum amount of questions. So I don't know what was going on with that one, but 4th time I passed it. So I don't even want to take this one time. And I feel like I'm only going to take this one time. I feel very confident already. And I'm still in module 1. So that's that. And I do it this way because I can teach myself. If you're not good at teaching yourself, I would recommend doing a live review. Like they do it on Zoom and stuff or whatnot. So I would recommend doing a live review with somebody. But this is just how I choose to do it. And hopefully I'll be successful. All right, guys. Have a good night. And thanks again. Bye.